which one is fake, which one is true. But they said everything, all kind thing is fake. That fake is coming from, like we told, from Vietnamese SNS. So that's really we also about. That's why he came to tell us about that, what happens. Okay, so that's why we're meeting today. We are here today, the meeting. So first of all, let me ask the Scott. In Garden, especially Garden, for many Korean villages here. So they're so worried about, especially like H-Mart and restaurants. All the time they worry about the not many people coming on this day because many people they stay home. I know that. So why don't you say something about that kind of situation?
Sure.
Yeah.
Sure.
Be so honest.
So first of all, I think what's important to say is there are no known cases of coronavirus in Garden Grove right now. I think that's important to say right away. What we wanted to point out to everybody is that there's a lot of misinformation circulating about the coronavirus on social media. And do not believe everything you read. The point we want to make is we want everyone to rely on trusted health authorities, and that includes the Orange County Healthcare Agency, the Centers for Disease Control and Prevention, the California Department of Public Health, and the City of Garden Grove. And Orange County has a trusted webpage, which is ochealthinfo.com. You can also visit the City of Garden Grove's dedicated coronavirus webpage at ggcity.org/coronavirus to obtain accurate information and to learn about preventive measures. And our webpage links into all of the accurate information at the county.
It's kind of the hotline.
Yeah, I was going to mention this. And as the situation develops, both the city and the county will continue to update our pages with the most current information available. And when people have questions, everyone should be using, the county has their hotline set up, and that number is 1-800-564-8448. And so I thought I would just add that information. I don't know if you want to.
Can I just add to that the hotline, the health referral line is answered by live operators Monday through Friday from 8 to 5.
Of the languages here.
We can handle translation as necessary, yes. The webpage, ochealthinfo.com, that will link to information about coronavirus, has the ability to be translated into multiple languages using Google Translate. And we are updating a number of our documents. We have an infographic, we have frequently asked questions that hopefully by the end of the day will be up and available in Korean.
Oh, great. That's in Korean.
Yes.
Today.
I'm hoping by the end of the day. They are out, documents are out as the translators as we speak. So
What the Vietnamese
is, we will have English, Spanish, Chinese, Korean, Vietnamese, Persian, I believe, is what we're working on right now.
That's great.
So within the next day or so, all of those languages should be available for our key documents, our frequently asked questions, and our infographic that has basic information.
Tom, let me ask you directly. How can you catch the fake news creator? Can you do that?
So, are you asking how we catch them? So, when we look at it, we really don't want to get into a position that we're going to start looking at prosecuting and really getting down into false information and that, because to be quite honest with you, I think there's so much panic with the community out there that they might hear something from a friend and they're just sharing the information. So it's really hard to show the intent. And that's really why I would say that we really need to focus on going to the true source of the information to make sure that everything is correct. And those are the websites, it's the hotlines and everything else that if we're confronted with some type of false information, like the false information that, we were reported that a 16-year-old female Vietnamese had contracted the coronavirus. And so what we did as a police department is we reached out to our county and our state partners, and we confirmed that it's 100% false information. We have no information whatsoever that has anyone contracting the coronavirus inside the city of Garden Grove. So for me, I really want to focus on talking to the community about making sure that we're confirming our information before we're placing anything on social media, which can go all over and go viral.
Question.
Okay, go ahead.
Have you find out who and when the news initially started?
No, we did not. And to be quite honest with you, I don't know that I am going to do that type of investigative work. Look, I think when it comes down to it, everyone's concerned, right? Everyone's concerned, and they're going to share information. Now, we're going to continue. We are doing some type of investigation on this, but I'm not going to go down a path of letting the community know that we're singling out a certain person, because I think it's important for people to share that information, but please verify it before we share it. And if you have questions, get hold of our city hotline, get hold of the Orange County Healthcare Agency, call us and we can direct you to that as well, our non-emergency number.
Yes, I was informed on Monday about the fake news at HMart on Monday. I contact our city manager office immediately and asked the city to communicate with the Orange County Health Agency to verify and notify the public. I agree with the chief that we may not want to jump in and investigate and start prosecuting people who share the information. But I think what is very important for us to learn about this, the lesson of this incident, so that there is coordination between the Orange County Health Agency and with all of the city involved, so that if this thing flare up, we identify the information immediately and notify the public via same path of the day. So let's just say if we see that on the Facebook, then we need to stop the source immediately, right at the source of the fake news, so that it doesn't spread further and cause havoc in the community. And I think that is a key thing that we need. We need very tightened coordination and communication between Orange County, the city, and the police, so that we can assimilate the information immediately out to social media, so that the spread of the rumor can be stopped immediately.
And if I may add, so the healthcare agency is very active on social media, on Facebook and Twitter, and part of what we try to do in those platforms is correct misinformation that's out there. So as the city or others become available with information you believe is inaccurate, and you can let us know that, we can, as the authoritative source for health, repost information, retweet information, correct information. And that's been very, very helpful to us. If you see things, please let us know so that we can correct it on the record from the healthcare agency.
I have just
Okay, one question.
if the police department find out the person who make fake news, what kind of a punishment do it?
Well, that's the thing that I'm trying to talk about. Look, it's very important for the Garden Grove Police Department, number one, to provide a safe environment, right, to protect our community, but also to have a very good business community and to protect our businesses. So it's a double-edged sword for us here. Look, this is why we're here. We're here to tell you this is completely false. There is absolutely no coronavirus that came from within one of our businesses inside of our community. And to be quite honest with you, like I said, there's so much panic about this within the community, and people are sharing information. I think it's just important for the city, number one, not to look at maybe punishing, but to correct the information and work with our partners just to make sure we're getting accurate information out there. So maybe we need to do a really good job of just monitoring social media, and when we become aware of this, that we really jump on it real quick with the Orange County Healthcare Agency, with the police department, to get the message out.
Okay, Charles, I see you have a question for that, how to protect our community, especially vulnerable business. So you can ask from the city or any idea to protect them?
Well, basically, there are people that are creating the false news, and it is very severe for the community, for the businesses and the tenants and the markets. So I think there's got to be some sort of like a punishment from the police department as far as what the punishment is going to be for the falsifying fake news and stuff like that.
So thank you very much for doing this, because don't panic. I mean, it's very important. So we have stakeholders meeting right now, and actually 11 o'clock at the county office, that we are meeting with all the not just elected people, but city managers, Scott's here instead of Scott's there. That we try to put it together because there's a lot of misunderstanding going around. So first thing is they should not panic. I brought David because David's going to explain that how you're going to get getting infected by infected people, because you just pass through like this. You're not going to get it. I mean, this is just ridiculous. People going around, and this is going to kill a lot of businesses, especially Orange County. We have lots of tourism. Tourism is most important. Tourists are coming in, and we cannot really stop everybody. That's why we are having stakeholders workshop today, and we are having, another session with other people that we try to give all the right information. And second thing is, I'm going to ask our DA's office that, how they're going to prosecute when they started this false rumor, because this is not really good for the businesses. If their competitors are doing it, it's much worse. But this is all wrong. It started from LA too, that these gossips going around, that's going to hurt the business a lot. That's why I know, John Kim, thank you very much for having a press conference. Right now, Dr. Nicole Quick, who is a county health officer, that she is working on it with the stakeholders. So I'm so glad David's here. So David's going to explain a little bit about that, how you're going to get infected. So you have to go out to the community that, if somebody is sitting there for less than 10 minutes together, you're never going to get infected. So let's go, with the right information. Let's not panic. We just wash our hands, more often. This is what our parents used to say. You have to clean yourself up. If you do that, then you're not going to get really sick. So I'm going to ask Dave to speak just a little rules that, how you're going to prevent and how you're going to protect it, right? It's going to explain. Let me talk about the declaring emergency. Local emergency it's a local emergency, so county can control that. We never had any patients until we declared the emergency. We already sent the press release out to let people know that that's what city governments and other governments said. They have to explain to their residents, especially Korean American community. When somebody who speaks Korean, they go out. Vietnamese community, somebody who speaks Vietnamese, that who can go out. We did that because not just funding coming in from the state and federal government, but when patients existed in Orange County, what we can do is we can work closely with the other jurisdiction, and hospitals can work together. Right now we have 2 coronavirus patients in Orange County. What we did was healthcare agency just went out and we actually quarantined those people, and we are testing those people how long they're going to be quarantined, when they're going to release. So this is really important. Not we are getting power, but this is county health officer is going to get the power to move without our permission or authorization going on. So that's the reason that we declared a local emergency. Having said that, I want David to explain about that. How are we gonna get you're gonna get infected by transfer those disease from one patient to another just a little bit, because we're gonna have another workshop at the county level.
Okay, thank you very much. So thank you, Trevor. So in terms of how, what we're concerned about in terms of transmission, so there is no recommendation at this time for people to stay home, to change their daily activities, to stay away from restaurants. We want people to go about their daily lives. We want you to do common sense things, as the chairwoman said, that we ask you to do for cold and flu season. Wash your hands with soap and water, cover your coughs, cover your sneezes, and especially important, if you are ill, please stay home from school, please stay home from work. This coronavirus is really not transmitted by us, say, being in the same grocery store together while we're out shopping. It is more person-to-person contact when you're in close proximity for a period of time. Coughing and sneezing is typically where we see the transmission occur. But we, at this time, are not recommending any changes to public gatherings, to people going about their daily lives, to children attending school. For individuals who might be a close contact to a case, if they are, they would be hearing from the health department, and we would be taking appropriate action to ensure that person is being screened and isolated or quarantined as appropriate. So I appreciate all of the comments about the challenge with misinformation, because I will tell you, we spend a great deal of time at the healthcare agency trying to correct misinformation through our social media sites and through our public information office for this very reason, because we don't want people overly panicked. That said, I think it's important to understand that there is much more testing going on now for coronavirus, so many more people in the coming days and weeks will be tested. We expect to see more cases in the coming days and weeks in the United States and here in California. So we want people to sort of be aware that that is expected and not unexpected. At the present time, that does not change how we manage or respond. It keeps me busier, keeps my staff busier, but for the general public, until you hear from us otherwise, go about and live your lives, enjoy your families, enjoy your outings, shop at all the local stores, and eat in all the local restaurants.
Follow-up question on the testing and the misinformation. For the testing, what is the procedure? Is there a established procedure for citizens to get tested?
Thank you. So the question was regarding testing and how you access testing. So presently, what we are requesting or requiring is that individuals who need to be tested actually be seen by their healthcare provider. The healthcare provider will evaluate them and at the present time will contact the health department, because as of today, we are the only laboratory in Orange County that can do the testing. So we are testing individuals who are potential individuals who we may have strong belief could be infected, so we want to be testing them. Many of you may have heard Vice President Pence and also the governor talk about the desire for having really anybody be tested if their healthcare provider requests that. We are hoping that private laboratories in the coming days and weeks will bring up that capacity so that that testing is there and people can be tested much more rapidly and much more timely.
We can add that because since we declared the local emergency, before that we used to send all these testing kits out to CDC, Centers for Disease Control. Now we are doing here. It used to be turnaround time was 2 days to 1 week. Now it's 24 hours. So we can get it done. That's the reason that our healthcare agencies are doing really good, and we are testing actually everything in here.
Is it free for the testing, and what happened to the people who don't have access to the primary care physician?
So the testing today that is done by the healthcare agency, there is no charge from the healthcare agency for that testing. Individuals will be able, as they do for healthcare, to access community clinics, if that's a source that they use for healthcare. Certainly emergency rooms are available for people who are severely ill. We don't want people with very mild symptoms walking into emergency rooms. And we want anybody who might have a suspicion that they are infected because of travel history or other things to call their healthcare provider beforehand.
Supervisor Stiles, you were mentioned earlier, I just want to confirm real quick, the misinformation is not coming from the competition of the business in the area, but it's coming everywhere, including LA County?
You know what? Actually, LA County started that. So there's, Korean air stewardess that went to 5 different restaurants, but then they stayed in LA only for 24 hours period. You don't eat 5 meals at the restaurant when you do that. So those 5 restaurants were actually mentioned on the Facebook, and then you know what? Those businesses were like, they didn't have any, customers for how many days. So that started there. So here, that I just heard, when we set up this press conference, so I didn't know anything happened in Orange County. So you know what? This is false rumors. If somebody could spread false rumors, I'm going to ask DAs that what's the process? What kind of prosecute that they're going to do? So we're going to find out a little more about it because it seems like it's spread.
And I will just say again, if you are a contact to a case that needs to be concerned, you will be hearing from the health department. So at this time, if you haven't heard from the health department, that means that we are not investigating something that chances are it is not a correct piece of information.
So how will they hear from the health department? Through text messages? Or
You can go to the website. We are updating every day that new information is coming out. Then we're updating everything.
Yes, so certainly our website, but if an individual needs to be contacted, we will be reaching out through telephone, through media if it were necessary. But most of the time, the contacts that we need to reach are not people who just pass through in a grocery store, but a close family member, a friend, somebody that they've spent time with. We actually pick up the phone, we call them, we do an interview, determine if they're at risk or not, and take appropriate actions from there.
Anyway, one quick question. You did not answer my earlier question. There's a lot of people in the community ask us whether or not should we not encouraging people to stocking up waters, foods. So when people ask us that, what should be the proper response?
So that's a very good question. I don't know that there is a need to panic and panic purchase. I will say that standard emergency preparedness, and I'm sure the police chief would agree with me, is something important for everyone to assure that you have, and more importantly, probably for an earthquake or other situation, not for coronavirus, to have emergency supplies available, but not to panic purchase in response to coronavirus.
That's not very not very comforting because the Vietnamese community are panicking, and when people are seeing people going out there, one person last week I saw a picture buying 24 cases of this water bottle alone, and they're fighting over food on the shelf at Costco, and it's just empty within a matter of hours. That kind of behavior will cause the community to be even more panicked because they see other people are buying it. So my question to you is, if my community asks me, I'm the chairman of the Vietnamese community as well as council member. If my community asks me, Mr. Bui, should we go out there and encourage people not to stocking water and food? What should be my response to them?
In response to coronavirus, I would say no. In response to general emergency preparedness, I think our general recommendations are always that people have supplies available, but I don't think panic purchasing today is the way to prepare for the emergency. But in response to coronavirus, there's not a need right now. The risk in the Orange County community today from coronavirus remains low.
Can you put that recommendation on the health agency website so that I can go there? Because I'm very reluctant of suggesting one way or the other because I might be.
Yeah, I appreciate that.
I might be
We'll
liable.
look at what kind of messaging we can push out that'll help to clarify that. I do think it's a good point, because that, I think, back to the chairwoman's point, kind of feeds into the panic and concern that's out there, and a little bit of part of the misinformation. So let us work on that and see what we can do to help you out with that. Control and prevention criteria in terms of individuals who meet what we call persons under investigation criteria. So typically it's travel history. It's a combination of travel history, symptoms, close contact with a known case, or people with severe respiratory illness that don't have another risk factor. So those are the criteria we use, and we're evaluating them when a healthcare provider calls our office to determine if they're appropriate for testing right now. That's only because we are really currently the only lab available to do this in Orange County. As I said, hopefully within the next several days to week or two, that capacity expands significantly. So basically anybody who requests a test through their healthcare provider should be able to get it.
So is there any enough testing kits in Orange County?
We are testing in Orange County. The Orange County Public Health Laboratory is the site that is doing testing now in Orange County.
I'm sorry,
And we
we
have,
have sufficient.
and we have sufficient supplies available to do the testing for the populations that are at risk right now.
So actually, a lot of people worry there's no vaccine available at this time. That's the problem. That when you're going to make another vaccine for the
If I were going to make a vaccine, I'd be a very rich man. There is research going on, but don't expect a vaccine anytime in the next 1 year to year and a half. It will take time before a vaccine's available. The majority of people who become infected with COVID-19, though, will have mild to moderate symptoms. They will not become severely ill. Those who are elderly or have other underlying health conditions or most at risk, what should be a little bit comforting to all of this is that, interestingly, children don't seem to be overly at risk for serious disease from COVID-19.